As Tony says, I'm from Health and Social Services. I was at the Odeon a year ago today, launching the care strategy for the island. Those that were there will remember that this was a strategy that was put together by not just the health department but other players in the market as well. So family nursing and home care played a big part in this. The primary care body, so that's the GPs in the island, were absolutely integral to this. So going back to a point that Joe made earlier, we do have a strategy. The benefit in us having our strategy was that it brought all different sectors of health and social care across the island together. This wasn't a paper exercise, it's not a paper exercise. This is beginning now to deliver some real change in the way we provide and deliver care in the future and the way we make decisions. So this is hugely important to us, and I want to spend a few minutes today just telling you what we've done during the year, reminding you what the strategy is all about, and finishing off by telling you what we're likely to do next. I think it's worth just reflecting back on what the strategy was, and forgive me, I'm just going to read some of the words out. Jersey is a digitally world-class health and social care system. This is what we're trying to achieve. That's it in one line. It's a place where we use technology across the service to deliver accessible, joined-up, person-centred care. This is about delivering care to us, to our family and friends. This is not really a techie thing. This is about making sure that we get the best possible care. That care needs to be safe, effective and efficient. This is about making the best use of our resources. The demand for health and social care in Jersey, as with most of the developed world, that demand is going up and up and up. If we don't change the way we deliver our services, just as the rest of the economy does, we will not meet that demand. We want to be in a place where data is used intelligently to improve care wherever we can. Everybody else is doing it. Finance industry we know is using data to improve their services. It's used across all sectors. We need to be doing the same. And lastly, and really importantly, is we need an environment where innovation flourishes. We can see innovation in healthcare and social care every week that goes by. There's new ideas, new thoughts that come. The Institute of Clinical Excellence in the UK is now assessing phone apps to actually treat depression. They're assessing those alongside other traditional treatments. We need to be in a place where we can take advantage of this. There's all sorts of things going on. There's robotic surgery. Jersey is an ideal place to test some of these innovations out. At the core of our strategy was a Jersey care record. This is how we would bring data together from all different parts of the system across the island to make sure that we can deliver the safest care possible. If you go to your GP, historically, they don't know what might have happened to you in the emergency department yesterday. If you go to the emergency department, they might not know what happened to you at your GP yesterday. This is about making sure that those that are caring for us as individuals have the information they need to look after us when we're vulnerable, when we need that care. The Jersey Care Record was about pulling that information together and enabling that information to be used to transform the way that we provide our services. This is just one part of our overall transformation programme, but it's central to many, many of the changes we're making. If you think about the plans for the future hospital, technology will be a major feature in there. We will be able to do things in there that we can't do in the current building, simply because of the age of it and the infrastructure that's in there. We all live our own lives. They're complicated lives. Those of us that have conditions, fall ill from time to time, need care, need treatment, that needs to fit in with our lives. We don't want our lives driven by the care that we need or only being able to access particular services at particular times or in particular places. We need to develop the way we're providing our services to fit with our lifestyles, with our needs and requirements. This is key to what we're trying to do with this particular strategy, to make sure that we put the systems and services in place that fit with the lifestyles that we lead today and that we want to lead tomorrow. So I want to spend a few moments talking about what we've done over the last year. And we have made some really good progress. We've done a lot of work building on the foundations. This is one of those areas where you've got to have the infrastructure in place to build upon. Others have talked about the innovation group that we've set up. This is a group of frontline staff, clinicians, social care workers, nurses, who are interested in taking advantage of new ideas, new technologies, innovations in this field to provide better care. We need a way to funnel that, to take advantage of it where it's appropriate and to work on it quickly. These are not ideas and thoughts that you necessarily want to take 6-12 months to come to fruition. You want to be able to help people test them out, see if they're going to work quickly and then deliver them. In terms of joining up care across the island, this was one of our major themes, that we need to join up care across the island. We need our technology to support all those people providing care, whether it's in a GP practice, at the hospital, in your own home. We've undertaken a major piece of work this year to start joining up the primary care systems and the hospital systems. This is particularly around diagnostic services. So when you go to your GP and your GP says you need some blood tests, you need an X-ray, you need an MRI scan, at the moment that's very paper-based. So there's bits of papers that flow from the GP to the hospital and then the test results go back again. We've spent a lot of time this year developing an automated electronic way of doing that, so that when you go to your GP, the GP will choose tests, select them, send a message through to the labs at the hospital, and they will be ready to do those tests and send the results back electronically. That will make them available more quickly. That will reduce the risk of bits of paper going missing or getting delayed and so on. So that's a major achievement. The testing, the foundation for that is all coming to an end. We will start rolling that out this year. So that goes live, and us as patients will start to see that technology this year. We've done a lot of work around creating the foundation for the care record itself. So the technical and architecture and design work is done for that. We've implemented new systems, particularly in the children's service, where there's a brand new system that's working, making a difference to the way social care is provided to the children in the island already. Data, we've used huge amounts of our data and knowledge of past experience and projections going forward to plan mental health services, the future hospital. And in terms of having Jersey recognised as a world-class digital environment for health and social care, we hosted the conference with Digital Jersey that many of you will have come to. And most importantly, I think we've developed some very strong relationships with NHS Digital. NHS Digital are trying to do the same sorts of things that we're trying to do. Having that relationship will pay huge dividends to us over the coming years. What comes next? I think this is really important to understand. As I talked about, the primary care and secondary care diagnostic test request and results will go live in this year, 2018. In terms of the Jersey Care Record, we are planning to bring forward some pilots where there'll be an opportunity for islanders, some cohorts of patients, to actually start to test some of the potential systems that we may use going forward, to actually see what that looks like on a web page, on an app, however people want to view those things. We've been doing a lot of work with Southampton Hospital, where some of our patients already go, and where they're hosting some of these services for other hospitals around the UK already. So there's some interesting work going on there. We're going to continue with our work on our existing clinical systems to make sure that they're fit to work in the JCR landscape for the Jersey Care Record so that we're ready to integrate those in due course. And I just want to finish really by just saying this is where we are. We have made huge progress. Picking up on Joe's point earlier, this is not just a strategy that we've produced that's so thick that's sitting on the shelf somewhere. We have turned this strategy into real action. And we have made some real deliverables this year, and most importantly, all those that put this strategy together remain committed to deliver it. So this isn't just the government, this is GPs, this is the voluntary and community sector as well. And I just want to finish with one reflection from one of our colleagues from the NHS that came across for the conference earlier in the year, who reminded us the only reason we're doing this is for the patient at the end of the day. This is all about the patient, and we seriously are remembering that in all that we do, and that's how we're testing whether this makes a difference. Does it make a difference for the patient or the individual at the end of the service? That remains our core focus. Thank you very much.